And we so appreciate you being here, because that's what the goal is, to share with the folks out there that, hey, what are these medicines? How do you become dependent? So again, I mean, this is so helpful. What are some of these symptoms and signs that we should be looking for in our body, both physically and mentally, that can tell us that, okay, we are dependent on these medicines?
Well, in terms of physical withdrawal, the symptoms are very similar to having the flu, influenza. So you might have some symptoms of runny nose, watery eyes, nasal congestion. You'll have some stomach issues like nausea, vomiting, diarrhea can happen, stomach cramping, abdominal cramping. You can also have changes in your sleep patterns, either sleeping too much or some insomnia, some restlessness, and body aches, muscle pain. So it could be a combination of all of those things. And even though it's not a medical emergency of having withdrawal, it's not dangerous to have withdrawal. But the danger is that it will cause that person to seek out that medication further. Also, when it comes to the emotional dependence part, I think you will start, and even loved ones may notice some changes, that there may be some emotional withdrawal, some isolation, that people will withdraw from their family and friends. They may be missing work. It may be affecting their academic studies. Maybe some moodiness, mood swings, mood changes. Depression can even happen. So there's a lot of different signs in even the personality that may show, that will indicate that the person may be becoming addicted.
Oh, wow. So it's so interesting that how our bodies can react and respond to these opiate medications. Just out of curiosity, and I'm sure many people are so curious out there, what exactly do these drugs or these medications do in our brain? I mean, how do they affect on our body?
Well, they actually act on the pain receptors that we have in our body. We have pain receptors in our brain. We have pain receptors throughout our body. And it will latch onto those opiate receptors, which we all have. We all have these opiate receptors. And what will happen over time is, when the body uses these opiate medications over a period of time, our brain will actually create more and more receptors so that we can get more of that drug into the body. So the more tolerance that we have, the reason we have some of that tolerance is because there's all of these open receptors out there, and the brain wants more. And when it's not gaining more at that time, it's searching for it. And that's also a sign of the withdrawal symptoms, because we have all of these screaming receptors out there that are looking for the medication. And if it's not receiving it, it will, instead of creating that euphoria, it will actually make us feel sick, or make us feel like we cannot survive without it. A desperate feeling.
Wow, that is so amazing. So it really works at a molecular level, means inside our body, cellular level. So once we notice that we are dependent on these opiates and we're getting these symptoms of withdrawal, and I'm sure you must have noticed that in your practice, when this client or this patient goes back to the doctor who gave him the medicine in the first place, what have you witnessed in your practice? Like, how do the medical providers at that point address it, or how should they address it? I mean, what can they tell this patient by which the patient will recognize that I'm dependent? Because, I have seen during my practice, when some of these clients come, they don't want to believe that we're dependent. Some of them are angry. Some of them go like, what do you mean? This medicine is helping me. So why are you not giving it to me? So some of, if you can share with, even for not just the providers, but even for the general people out there, like what to look for, how to ask, and then what can a provider do? Because at that point, they usually don't come to you, right? I mean,
Right. Yeah, you're correct. I feel like there is such an element of denial there. And because you're not even aware of how you feel that desperation, you feel that sense of survival, that the brain tricks you into almost feeling like just like it needs shelter, water, food for survival. It's right up there in terms of I need this in order to feel like I am my usual person. And it will become that way. Unfortunately, there becomes a point where when a person is actually addicted, they are really just using the substance to feel normal. It's not even a high anymore, but they know that the withdrawal symptoms are so uncomfortable for them that they're searching for the substance, just not to become ill. And I think because of that desperation, they may tend to run out of their medication early. So the doctors may see signs that they may have a real preoccupation with that medication, maybe calling very regularly to say, I need a higher dose, this isn't working, or maybe they're taking more of the pills and they run short before the end of the month. And they may be indicating some signs of withdrawal. And yes, if there is that confrontation, which I think it is important for the doctor to very compassionately call that to their attention, because there is that desperation there, I feel like that's even a stronger indicator that this person may be becoming addicted. And possibly at that point, maybe they would refer that person to either a psychiatrist, a mental health provider, possibly a counselor, maybe even considering a support group for other people with the chronic pain issues or addictions, narcotic addictions. But you're right. I think it takes quite a bit of time for people to get through that part of denial. And sometimes there has to be some really significant consequences before they get to the point where they feel that they can acknowledge that it's a major problem in their lives.
I hear you, because that's so important to intervene at the right time. So if I understood you correct, so it's pretty clear, it becomes pretty evident when we feel that a client has sort of become dependent on the medicine, as you said, that maybe they're running out early or they're seeking more. And at that point, if their provider can, of course, talk to them and of course discuss that, hey, this is happening. But as you mentioned, that a lot of our clients may be in denial. They may get angry. So at that point, referring them to the right professional, which is either an addiction specialist, and as you mentioned, a counselor or a psychiatrist, I think that can be crucial. Dr. Madrak, share with us, if you may, about like how do we distinguish between dependence and addiction, meaning when is a person dependent on the medicine, not with an intention to abuse it? And when is it an addiction? How would we tell the difference?
Mhm. I think more of the dependence is along the lines of the biological, physical dependence, where people can have either that tolerance of needing more frequent or higher doses, or they may have withdrawal if you take that substance away, and you'll have those physical symptoms as that withdrawal, which, as I had said, that's kind of how the medications work. So that will happen, unfortunately, over a period of time if everyone continues using that medication. But when does a person actually become addicted? Yes, there could be that physical dependence there, but also that emotional component of it too, where the consequences could be very negative, and the patient or the person may still want to have that desperate need to find that medication, whether it means they may be doctor shopping and going to multiple doctors, whether they may be seeking it out illegally through other means. It's not unusual for people to actually switch to a more potent substance, such as possibly heroin, because oxycodone, if you're purchasing it illegally, it's actually much more expensive than buying heroin. So unfortunately, that's where the trouble comes in, because you're dealing with something so much more potent that's less expensive and easier for them to obtain. And there's also a lot of negative consequences that can be happening in addiction, such as losing partners, marriages dissolving, interference with their children and custody of children, losing jobs, missing school, missing work. And in spite of all those things, they're still proceeding forward to obtain that substance.
Oh, wow. So when we go into this realm of addiction, so we're basically then talking about a substantial impairment, not only in their personal life, in their professional lives, financial, and so in every aspect of life, then it basically affects them enormously. There's one, we talk about dependence, means when people get dependent on prescription medications, which are opiates. And then we're, as you said, we're talking about addiction. Now, with the clients that you see who fall under that umbrella of addiction, what are some of the most commonly opiates that you find folks are getting addicted to?
I'm saying primarily oxycodone and OxyContin, which is a little longer acting pain medication. By the time they come to me, often they're already switching to heroin. However, the unfortunate aspect of it is that heroin is often cut and sort of diluted, so to speak, with fentanyl, which fentanyl is 50 times more potent than heroin. So unfortunately, with what's available to people illegally is so extremely dangerous that there may have already been maybe some non-fatal, fortunately, overdoses, but there's been some significant problems in their lives. And I feel like primarily OxyContin, oxycodone, and fentanyl. From what I understand, there's many countries that are dealing with tramadol for the same reason, is that possibly tramadol and oxycodone are used more interchangeably. So this is not really just a problem in the United States, but it's really becoming a major issue throughout the world.
Out of the all whatever is available, as you mentioned, like oxycodone, hydrocodone, and then heroin, they all fall under natural opiates. And then you mentioned that then comes the fentanyl and the tramadol, which are under synthetic derivatives. Is there any major difference in terms of how they work in our body, meaning the natural and the synthetic?
Well, really, they act in a similar way on those pain receptors. Really, some of the differences is how short acting something might be has a tendency for people to actually gravitate towards that medication and take more. So say, for instance, if I were to say that OxyContin, because it's slightly longer acting, there's less of a tendency to abuse that than the oxycodone that is shorter acting, because it's wearing off more quickly. People may feel either breakthrough pain or possibly withdrawal symptoms, and then tend to abuse that. So it seems that the shorter acting the medication is, the more highly abusable it is, even with other types of controlled medications, like such as tranquilizers, and that being the case. So you really do have to watch with prescribing the shorter acting medications, because there is always that tendency to take more because they do wear off more quickly. Although it can potentially happen with all of them. So I tend to think of them as all being potentially dangerous, because if you gravitate towards one, you may start experimenting with another, and before you know it, there's a problem.
I hear you. Yes, this is again a very important point, as you mentioned with sedatives. Same thing happens, like shorter the the duration of a medication working, higher the chance of us to get dependent or addicted to it. So do you recommend even for the providers out there, like say, for example, if they begin someone with a opiate medication and they need it, like they've had a massive surgery or, something like that, would you then recommend that they most likely consider a longer acting opiate for them rather than the shorter one?
I think that would be the case, although not to have that mistake of thinking that because I'm taking something longer acting, this is less dangerous for me. Yes, there is less of that tendency to have that need to take more and more, even in a short period of time, but to know potentially that there's still risk with that. And then if it's used as short term as possible, and when someone can switch over to a non-narcotic pain medication at that point in time, that would be the ideal.
Okay, so I hear you. So basically, even though the risks are a little bit low, but there are still risks to get dependent and addicted.